Good afternoon. Welcome to this edition of the 401 Talk Zone radio show. My name is Leon Jones. Today's topic, we're going to talk about the types and symptoms of sexual dysfunction. Types and symptoms of sexual dysfunction. Now, before I get into the topic, one must understand the definition and the characteristics of sexual dysfunction. So basically, when we talk about sexual dysfunction, it refers to a problem occurring during any phase of the sexual response cycle that prevents the individual or couple from experiencing excitement from sexual activity. Now, excitement, I'm going to use the synonym, call it satisfaction, from an orgasm. Now, the sexual response cycle traditionally includes plateau, excitement, orgasm, and resolution. Also, desire and arousal are both part of the excitement phase of the sexual response. While research suggests that sexual dysfunction is common, with 43% of women and 31% of men, they report some degree of sexual dysfunction. It is a topic that many people don't want to discuss because treatment options are definitely available. It is important to share your concerns with your partner and healthcare provider. Now, with any disorder or dysfunction that I have done with my video series, there are different types of sexual dysfunction. Sexual dysfunction is divided into 4 categories. There are desire disorders, which definition is the lack of sexual desire or interest in sex. Then there are arousal disorders, inability to become physically aroused or excited during sexual activity. Orgasmic or orgasm disorders, which talks about a delay or absence of orgasms or a climax. Then you have pain disorders, which it indicates there is pain during intercourse. But who is affected? Well, sexual dysfunction can affect any age. Although it is more common in those over 40, it is often related to a decline in health associated with aging. Now, there are symptoms. Now, in men, it is the inability to achieve or maintain an erection suitable for intercourse. That's known as erectile dysfunction. Also in men, absent or delayed ejaculation despite adequate sexual stimulation. That's known as retarded ejaculation. And the inability to control the timing of ejaculation. Well, the timing, some guys may ejaculate early or prematurely. Now, when it comes to women, it's the inability to achieve an orgasm, the inadequate vaginal lubrication before and during intercourse, the inability to relax the vaginal muscles enough to have or allow sexual intercourse. Now, in both men and women, a lack of interest in or desire for sex, the inability to become aroused. And also with men and women, it's pain with the act of intercourse. Now, what causes dysfunction? Well, with physical causes, many physical or medical conditions can cause problems with sexual function. These conditions include, you're going to catch these, diabetes, heart and vascular or blood vessel disease, neurological disorders, hormonal imbalances, chronic diseases such as kidney or heart failure, and alcoholism, as well as drug abuse. Now, in addition, the side effects of some medications, including some antidepressant drugs, can affect sexual function. There are also psychological cases as well, or psychological causes. These include work-related stress and anxiety, concern about sexual performance, marital or relationship problems, depression, feelings of guilt, concern about body image, and the effects of a past sexual trauma. Now, how is sexual dysfunction diagnosed? In most cases, the individual recognizes that there is a problem interfering with his or her enjoyment or the partner's enjoyment of a sexual relationship. The clinician will likely begin with a complete history of symptoms and a physical. He or she may order a diagnostic test to rule out any medical problems that may be contributing to the sexual dysfunction. If needed, typically lab testing plays a very limited role in the diagnosis of sexual dysfunction. An evaluation of the person's attitude about sex, as well as other possible contributing factors such as fear, anxiety, past sexual trauma/abuse, relationship concerns, medications, alcohol, or drug abuse, will help the clinician understand the underlying cause of the problem of sexual dysfunction and will help him or her make recommendations for appropriate treatment. Now, how is it treated? Well, many types of sexual dysfunction can be corrected by treating the underlying physical or psychological problems. Now, other treatment strategies include medication. Now, when medication is the cause of the dysfunction, a change in the medication may help. Men and women with hormone deficiencies may benefit from hormone shots, pills, and creams. For men, drugs including Viagra, Cialis, Levitra, and Staxin and Stendra may help improve sexual function by increasing blood flow to the penis. Mechanical aids such as vacuum devices and penile implants. That's right, penile implants may help men with erectile dysfunction. That's the ability to achieve an erection. A vacuum device known as Eros is also approved for use in women, but it can be costly. Dilators may help women who experience the narrowing of the vagina. Now, there's also sex therapy. Now, sex therapists can be helpful to couples experiencing a sexual problem that cannot be addressed by their primary clinician. Therapists are often good marital counselors as well. For the couple who wants to begin enjoying their sexual relationship, it is well worth the time and effort to work with a trained professional. Also have behavioral treatments, which involve various techniques, including insights into harmful behaviors in a relationship, or techniques such as self-stimulation for treatment of problems with arousal and orgasm. Psychotherapy. Therapy with a trained counselor can help a person address the sexual trauma from the past, feelings of anxiety, fear, or guilt, and poor body image, all of which may have an impact on the sexual function. Of course, there's education and communication. Now, education about sex and sexual behaviors and responses may help an individual overcome his or her anxieties about sexual function. Open dialogue with your partner about your needs and concerns also helps to overcome many barriers to a healthy sex life. Now, can sexual function or sexual dysfunction, can that be cured? Well, here's some ways you can cure it. The success of treatment for sexual dysfunction depends on the underlying cause of the problem. The outlook is good for dysfunction that is related to a condition that can be treated or reversed. A mild dysfunction that is related to stress, fear, or anxiety often can be successfully treated with counseling, education, and improved communication between partners. That's one thing a number of us really don't want to talk about when it comes to relationships, because many of us always believe relationships break up over finances. That is part of it. But when it comes to having any type of sexual activity, you want to be aroused by your partner. And individuals, particularly men, age 40 and over, sometimes cannot get an erection. And then you have women who don't want to have sex either. And if you listen to everything that I just said, some of it goes back to sexual traumas. And what's a sexual trauma? An event like a rape or molestation could have occurred. Of course, diabetes, alcoholism, they all play a part in sexual functions. Now, one must understand that sex is 90% psychological and 10% physical. Certain areas of a person can get a person aroused. The smell of the perfume and cologne, the smell of the hair, the touch, the caressing. If a person can't get aroused by that, then there is a problem, and the problem should be treated. And the best solvent is counseling. You can get medication, but a lot of these medications out here, they cause side effects. So if you're looking into Cialis or any other erectile drug to help arousal, particularly if you're a man or even if you're a woman, because I believe they have Viagra for women as well, please consult with a professional. Because if you want to keep your relationship, the bottom line is both parties should be satisfied with each other. And what I mean by satisfaction, have an orgasm. Because that's what you're trying to do. Reach the climax. If you're not doing it, then definitely seek help. And don't be afraid to ask for help. Don't be afraid to talk with your partner. One of the problems in most relationships that I have heard, no one talks about the sexual component. That should be numero uno, because down the line, sex is more than just the intercourse. Again, it's psychological. But when you get 40 and older, there are hormonal changes. Many individuals have gone through life, had children, they've been divorced, married, widowed. All these events take place, and after a while, they're in your mind. And one aspect that I am going to mention, go with meditation. Meditation can help overcome a lot of the stresses and the fears, because you're taking a step back, trying to clear your mind. Because in a good relationship, one must understand that sexual intercourse is a big component if you want your relationship to succeed. Now, that's my commentary for this afternoon's edition of the 411 Talk Zone radio show for Sunday, May 7th, 2017. You can tune in to the 411 Talk Zone radio show every Saturday from 6 p.m. to 8 p.m. on Blog Talk Radio. I had a good show yesterday. Talked about PTSD, post-traumatic stress disorder. I'm going to talk about schizophrenia this week. You don't want to miss that show. If you want to get on the air, hit number 1 in the queue. The guest call-in number is 215-383-5785. If you like my videos, please share and subscribe to the 411 Talk Zone radio show right here on YouTube, so I can continue to give you quality information for educational purposes from a professional and mature perspective. Now, on this channel, I don't engage in controversy, debates, or emotional issues, nor do I participate in drama or unnecessary bickering. Why? Because it's counterproductive. On this channel, I'm here to educate. So the information that I'm delivering is realistic but positive, because the millennial generation and even some of the older generations need to understand that the real world is challenging. And if you've been struggling and you're trying to utilize your same bad habits to get a different result, simply come over to my channel and I'll give you an alternative solution to help you modify what you're doing so you can live a happy life. Because again, everything on this channel that I promote is realistic and positive, because knowledge is power. And if you have a business topic or a new YouTube channel that you would like for me to discuss on YouTube or Blog Talk Radio, please email me at lej6521@gmail.com. And if you have a comment, or if you'd like to place a comment after you hear my videos, please put all of your comments under the video in the comment section. But make sure that your comments are pithy, no bloviating, pettifogging, or filibustering if you wish to opine. Now that's it for this video. Till next time, my name is Leon Jones. Remember, please be gentle and respectful to each other, and have a wonderful and blessed afternoon.